Hey guys, I welcome you all. So today in this video we will be learning about the concept of urinary incontinence. So what is urinary incontinence? As you can see, this means the loss of a bladder control, or when the person is unable to urinate properly. Means normally we know our urinary bladder is got some smooth thick muscles known as detrusor muscles, and below here lines the muscles of the pelvic floors, muscle of the pelvic floor. You know, this here is the sphincter. So when the coordination between these contraction of these detrusor muscles, whenever they try to contract, and relaxation of the sphincter, so that's why how we urinate we urinate when there is a contraction of the detrusor muscle, and simultaneously after that the relaxation of the sphincter relaxation, which is formed by the muscle of the pelvic floor. So whenever the coordination between these two loses, we saw a condition known as a urinary incontinence condition arise. So understand what is incontinence, and we can also take in account that normally the capacity of the bladder is normal bladder capacity is around 500 to 750 ml, and urge to urinate occur when it filled around 150 to 250 ml. This is a normal condition. So let's talk about the types of urinary incontinence. So number one in this list is we talk about is the stress incontinence. So what is stress incontinence? Whenever we understand by this, like whenever the stress on bladder increases, person will urinate. Like you all see the old ladies, old women's, whenever they laugh, when they run, when they sneeze abruptly, so there is a loss of urine occur from their bladder. This is sound funny, but this is not a funny thing, man. This is not a funny thing. This will sound funny, but not actual funny. This is person will feel embarrassed around the society. So this is a condition we need to treat it. So first we understand what is stress incontinence. Whenever the stress on the bladder increases, how the stress increases? When the intra abdominal pressure increase, like while the person during the person coughing, person is sneezing, person is running, person is laughing, or person is jumping, activities due to which the intra-abdominal pressure increases. But the question arises that the normal person is also doing this. Normal person also do these things, like I also cough, I also sneeze, I also run, but there is no sign of loss of urine occur from a bladder. Why is that? Now the main defect in this person is that you can understand the main problem in is that there is a loss of muscle strength of the pelvic floor. The muscles which are present here I'm talking about the muscles which are present here, these pelvic floor muscles which forming this sphincter. They are weakened. They are weakened. So whenever the stress comes, whenever the stress stimulus like laughing, coughing, sneezing occur, stress increases. This stress causes the detrusors to contract the detrusor, which ultimately open up the pelvic floor muscle because they are weak. But now the condition arises why they are weak. Now, like how they become weak. How they weak? They become weak in a person, in a most commonly in a women of multiparity, of multiple pregnancies, women having multiple pregnancies, because the women's having the history of the multiple pregnancy, they usually have the weak pelvic floor. They usually have weak pelvic floor muscles. Or it may be in menopause, because of due to decreased estrogen, they seen this condition. And now we know the stress comes in due to this. Another cause of stress is maybe like in pregnancy, like in obesity. So these are the conditions, and the classical finding in them is, what is the classical finding? The classical finding is that the incontinence seen after coughing, sneezing, running, laughing. So this is the classical finding. Now we talk about the second type of urinary incontinence, that is the urge incontinence. So as the name suggests, there is a constant urge to urinate. But how the flip is that? As we can see here is that we get the urge to urinate normally when it is filled around 150 to 250 ml of its capacity. We know normally we see the urge. Normally the urge appears when the bladder is filled from 150 to 250 ml of urine. This is the normal. But urge constant in the urge incontinence, there is a constant urge to urinate. It is because of when the bladder fills around 20 to 30 ml and still urges appear. But how they appear? Why? It is because of the most important thing. It is because of overactive bladder. It is because of the overactive bladder. What does it mean? What the flip is mean? The overactive bladder means that there is a increased detrusor muscle contractibility. Now there is an increased contractibility of the detrusor muscles. How? It is because of some neurological manifestations, or it may be because of urinary tract infections, like the bacteria like E. coli. They will stimulating the contractibility of the detrusor muscle, or maybe some neurological condition like in which spinal cord injury occurs, due to which the loss of inhibition, loss of inhibition is seen, ultimately due to which the ultimate condition is the increased contractibility of the detrusor muscle. And the classical finding you see, the classical finding is you see is increased urge, like frequent urination. Means like it, you can understand it by that, like whenever a person drink a glass of water, and after some time he will feel the urge to pee, and will feel the urge to pee, and seen mostly it's seen in patients of Parkinson during night, known as nocturia. And the next type of incontinence is overflow incontinence. This is like a opposite to the other. So in the urge incontinence, there is a constant urge. Why? Because of the overactive bladder, because of the increased contractility of the bladder. In the overflow incontinence, there is decreased contractibility of detrusor muscles. So what happens is that this is a bladder. Now some urine will fill, but it will stretch the wall of the detrusor muscle, but we know there is a decreased contractibility of the detrusor occur, due to which the urine will fill around 400 ml, but still no urge. Why? Because the contractibility of the detrusor muscle will decrease, due to which what happens is that the bladder overflows, bladder swells, and there is a dripping of urine occur. And the most important classical finding is that patient is unable to empty his bladder completely. Patient is unable to empty his bladder completely. There is some amount of urine is still there. Still left with some urine in his bladder. And another cause of the overflow incontinence is because of the enlarged prostate. It is because of if there is an enlargement of the prostate, enlarged prostate occur, like in condition of BPH. So what happens is that there is a obstruction in the flow. There is a obstruction in urinary flow. So even if the detrusor muscle is contracting, but there is some obstruction in that, so the urine will not pass through, and ultimately there is still left some urine in his bladder. Patient unable to empty his bladder completely. So these are the conditions. Now how the contractibility of the detrusor decrease is again having some etiology, that is, it may be because of neurologically deficient, like it's seen in multiple sclerosis, or maybe some spinal cord injury, spinal cord injury occur, the dead cell loses its contractibility, or it may be because of some anticholinergics the person is taking. Because we know the anticholinergics how they work, like anticholinergics like oxybutyrate, solifenacin, oxybutyrate and solifenacin. What they do is that we know, we can understand in this, like we know the bladder got the receptors, bladder got the some receptor like M3 receptors, it is a cholinergic receptors. And so these, whenever these receptor stimulates, they lead to the contraction. So some medications like anticholinergics, some medications like oxybutyrate or solfenacin, they inhibit this M3 receptors. Why? Means they act as antagonists, means they inhibit the binding of the acetylcholine to the M3 receptor, ultimately inhibiting the contractions. So this all about the pathophysiology of the urinary incontinence. Let's revise the types: stress incontinence and stress incontinence, urge incontinence, and overflow incontinence. In the stress incontinence, there is increased stress. It may be because of the, due to which the person will urinate. This is with stress increase, maybe because of the coughing, sneezing, running, laughing, jumping. And the main problem is that there is a loss of the muscle strength of the pelvic floor, seen in pregnancy, obesity, seen in a female or multiple pregnancies. And urge, there is a constant urge to urinate because of the overactive bladder. Some neurological conditions like Parkinsonism, constant urge to urinate, frequent urination. In overflow, there is a decreased contractility due to which the, even if the bladder is even if the bladder is filled with the urine, it will not contract, due to which the expansion of the bladder occur, and urine will dripping occur. And classical findings: patient unable to empty his bladder completely. There is some obstructions, like maybe because of enlarged prostate. So here this ends our video. Thanks for watching. Good day.